You're having a good one, and everybody is well, enjoying their November and the cool weather, which I hope will be coming down anytime. Rapamycin is such an exciting topic. We're going to be unlocking the secrets of longevity today. How we got to this, how I got interested, is not too long ago, about 3 years ago, I had a physician become a patient of mine. He looked really good. I should say he is in his 50s, but he looked like he's 30 something. We got to know each other a little better, and he asked me, could I write for him some rapamycin? He visited a Dr. Green in New York who was prescribing rapamycin for the purpose of improving people's health, longevity, health span. And I said, interesting. Normally, when somebody says rapamycin, that I was thinking transplant, I was thinking cancer maybe, but this was for a different reason. So I took a deep dive as well, went down that rabbit hole, and got more interested. And since then, I've been giving to patients in clinic and as well people that are suitable. I like to talk about this topic with them. So, what is rapamycin? Well, it's a natural compound that was found in the soil of Easter Island. This is a really interesting island. I actually visited it about 20 years ago, also called Rapa Nui. So it has these huge statues with the heads you may be familiar with. And scientists in the 1960s discovered this fascinating substance in the soil there. So the bacteria is actually the one producing the antifungal compound. And the name of it is Streptomyces hygroscopus. Initially, the pharmaceutical company was thinking about making it into a treatment for athlete's foot. It got shelved. Then they decided, well, actually, this is a great medicine for uh, graft versus host disease for patients that are having transplants, for those that need a kidney, a heart. Then they went into the treatment for coronary stents and as well cancer therapy. So at a high dose, that's what it does. It is doing immune suppression. Now, if we lower the dose, we are able to get something way better. So the mechanism of action of this medicine, it works by targeting the protein mTOR. That is short for mammalian target of rapamycin. It is regulating many things in our body. It's regulating cell growth, metabolism, our aging processes. There are two mTORs in the cell. There's mTOR1 and mTOR2. And mTOR1 is the one that we want to have targeted if we want to have a better life, if we want to especially live longer and have less diseases of aging. mTOR2, if that's targeted, then typically we find that is having the immune suppression, which we actually want to avoid. So, what does it do? It triggers autophagy. Autophagy is a very needed process in our bodies. It's basically like a uh, cleaning, housekeeping function. So, for anybody that has kids, especially, your house might be cluttered. Every day we are fighting the good fight. We have two children. They go in the toy room, they leave all their stuff in the living room. And here we are running after them, cleaning up. And sometimes our house can get a little out of control, just like our body, right? So we need a whole process to clean things up. Here we have the process of autophagy, right? It's a key to longevity. We have a lysosome, which is like a Roomba vacuum cleaner. It joins up with this other thing called a phagosome. It digests all these things that our cell doesn't need anymore. It repurposes them, and we have this beautiful balancing act going. But unfortunately, so many things in life get a little bit worse. So as we age, autophagy becomes less efficient. And guess what? We have more cardiovascular disease. We have cancer, which is running amok. Every decade, we get higher chance of getting cancer that we're around. Alzheimer's disease, neurodegenerative diseases, immune function gets worse as we age, as well as metabolic issues like diabetes type 2. So rapamycin can increase or ignite the fire of autophagy. It enhances cellular cleanup, optimizes our overall health, and it promotes the supporting features of that necessary feature. thereby we hopefully reduce all these age-related conditions that come with time. So how did we get to from immune suppression to longevity? Well, there was a trial where mice were given rapamycin at a lower dose, and they were showing life extension and less diseases than they typically would have. This was further replicated in other uh, types of animals or organisms, and that became universal. So yeasts, fruit flies, worms, mammals, all of them had this same reaction. Mice that were given the rapamycin in middle age got healthier and lived longer. So then, of course, we have to talk about us, right? So here's a slide about worms, right? Worms were able to be extended, autophagy was increased, then the mammals got some more attention, and there was a dog study. So dogs, man's best friend, found that they had benefit as well with rapamycin. Right now, there's a study next year that'll probably show us exactly how much benefit. The initial findings from a dog study showed that these dogs did have less disease and as well lived longer. What really got interesting is in 2014, there was a rapalog. So a rapalog is something that is very similar to rapamycin. The name of this medicine was called everolimus medicine. That's also used for transplant patients. It's used for drug-eluting stents. It's used for cancer therapy. So there was a short clinical trial where participants were given a flu shot. Now they were in four groups. There was a placebo group which didn't get anything from the everolimus. There was one that had a high dose, 20 milligrams given once a week. There was a daily dose of 0.5 milligrams, and there was a 5 milligram once a week dose. What was important from this study in humans, we saw that the 5 milligram once a week group had a augmentation or increase in that flu shot. So that was important. It actually did the opposite. It didn't suppress the immune system. It gave much more benefit. So that got doctors thinking, well, how about we add this to something as a geroprotectant or something we can do to help people? So right now I've been talking about all the great things that it can hopefully do, but let's talk about the things that we have to watch for. So everything in life has side effects. We have to realize that most common side effects from this medicine, rapamycin, are having a mouth sore every now and then. One can have a little diarrhea, little immune system suppression, but really this is a super safe medicine. Now, if you take it daily for the intended on-label purpose of immune suppression, you can, of course, have some increased infections down the line. Who shouldn't take this medicine? Well, those that are obviously pregnant, we don't want any problems there. There's also people that are young, right? So children should not take this. The ideal people that probably would want to consider something of this nature are people that are, in middle age. So we've seen that in all species, we are able to extend life. That's amazing. There's not really another medicine that can do that. In humans, it's really difficult to say how we can extend lifespan because obviously we live the longest, right? Dogs have a shorter lifespan, mice as well. But what we can follow, hopefully, is the health span benefits. And that's what's being done right now. There's some clinical trials which are following people that are usually self-funded to see if there's, for example, a drop in visceral fat or other biomarkers. Right now, we don't really have a good biomarker to watch for when we treat somebody with this off-label therapy. So that's something to keep in mind. But we have to understand that it's something that's been very safe. It has a 20-year plus history in treatment. And right now, a lot of folks are taking it and having good results. So what does the future look like? Well, we want to combine therapies, most likely, as we're just beginning to scratch the surface, right? So supplements, other safe pharmaceuticals, and new ones, I think, will be the future. But with that being said, we have to realize that you have to do the hard work. You can't just have this be a magical medicine and not sleep right, not eat right, not exercise. This is kind of a cherry on top to all the other things you're doing. Clearly, though, if you are needing a little extra help in your life, this could be a good solution. What are some of the reports that we're seeing that people are getting help with? Well, it has shown rapamycin has shown improved cardiovascular function on echocardiogram. There's also better oral health, better periodontal health, and that's also something we find linking to longevity. There's also a better metabolic fat mobilization. And what I've seen also, people are noticing less aches and pains. So that's a good way to get better quality of life as well. So right now, I'm offering this treatment in clinic. Of course, this is a discussion with a consultation. Not everybody's the right candidate, but if this makes sense, we welcome you to clinic and to expand our discussion on this really interesting topic.